So this section is section 4M, active compression, decompression, CPR adult. This is talking about the rescue pump and just kind of explains when we use it, contraindications for a rescue pump, and so on and so forth. So we'll jump into this real quick. Indication is adult non-traumatic cardiac arrest. So your contraindications, if your indication is non-traumatic arrest, you can probably assume what your contraindication is going to be. Traumatic cardiac arrest. Hanging and strangulation is not considered traumatic in this context. Obviously, we're not going to use a rescue pump if they have a pulse, because we don't do CPR on living people. And stereotomy less than estimated 6 months time. So the technique for this is going to be the correct compression decompression rate is 80, as we've talked about several times. Either the built-in two-tone metronome or an external metronome set to 80 should guide the rate. So on the rescue pump, it has its own metronome. You can click the button and it has a metronome on it. It also, I'll just scroll down and show you, it has this is what the rescue pump looks like on the left. So on the top of it is this little sticker. It's not a sticker, but it looks like a sticker, and when you go down, it will show you your depth. So use enough force to compress to at least 2 depth. And then if you hit that red button right there that says 80/minute, that's your button that will give you your metronome. So obviously your compression's when you're going down, and then your decompression is going to be when you're pulling up. And so you want to make sure you're getting within that range. So we'll scroll back up here. Number 2, the correct compression depth is 2 inches in adults when using the rescue pump. Excessive depths can lead to chest wall trauma, and chest wall trauma can lead to tension pneumothorax. The correct compression or force is whatever occurs at no more than 2 inches of depth in adults when using the rescue pump. In many adults, this will be at or very near 40 kilograms of force as measured on the device's force gauge, which should read as 0 kilograms of force when pulled out for the patient's use. But let the depth determine the force. Do not start out trying to achieve certain force regardless of depth. Excessive force can lead to chest wall trauma. Chest wall trauma can lead to tension pneumothorax. Number 4, any compression with the rescue pump should be directly midline of the sternum. Avoid placing the rescue pump laterally to the sternum. Improper placement can lead to chest wall trauma, and chest wall trauma can lead to tension pneumothorax. So I said it 3 times. Chest wall trauma can lead to tension pneumothorax. We want to try to avoid that at all costs. So this is why we have this rescue pump. It kind of guides us on our depth and how deep we really need to go. Number 5, the correct compression technique for the rescue pump involves the compressor's shoulders being over and in line with the sternum, producing a direct down compression and up decompression cycle. Even slight lateral movements of the rescue pump can cause the loss of suction between the device and the patient's chest, losing the active decompression advantage of the rescue pump. The correct decompression force of the rescue pump is at 10 kilograms as measured on the device's force gauge. Additional decompression force is unnecessary and could lead to chest wall trauma, and chest wall trauma can lead to tension pneumothorax. Avoid any rescue pump use when standing. All rescue pump assisted compression should be performed when kneeling immediately next to the patient's side. Avoid any rescue pump when the patient is in motion. This includes during movement of patient to the ambulance for transport, and this also includes when the patient's in the ambulance for transport going to the hospital. If unable to achieve consistent chest wall suction and active decompression with the rescue pump, discontinue its use and revert to manual chest compressions at 110 compressions per minute. Strategies to improve chest wall suction include wiping away any moisture on the chest and avoiding placement of therapy electrodes in the compression and decompression site. So some key things in here when you're transporting the patient, rather that be you're on the EMS side and you're in the back of the ambulance, or you're a firefighter riding in with the ambulance, we will not use the rescue pump when the patient's in motion. So from the time the patient is being moved from the floor to the stretcher, we will revert back to standard CPR, which is at 110 compressions per minute, and we can go back to the rescue pump in the ambulance if we're not moving, but the second we start moving, we have to go back to standard. Remember, we kind of talked about it earlier. If you have the rescue pump, you have to have the rescue pod. So the second you stop using the rescue pump, you have to take off the rescue pod. There's reasons for that, and we can hit that a little bit later on. But that's pretty much it for the rescue pump. There are cases where the rescue pump is not very effective because of the patient's condition or whatever, but it's not very common. So try to wipe off the patient's chest. If you are unable to get that decompression, if you look right here, when you're coming up, if you're unable to get that decompression for whatever reason, then go ahead and revert to the standard, and then document anytime you go from the rescue pump to the rescue or to standard CPR, then make sure you document why and all the details involved in that. The biggest purpose behind this rescue pump is the decompression. Yes, we're compressing down just like we do on CPR, but we're also pulling back up, allowing that chest to fully recoil. And so that allows the heart and all the blood inside the heart to fully have that force of pressure throughout and try to reach to the rest of the body. So I think that's about it with that. If you've never used this before, definitely look at it, play with it, and we will use it when we start doing our mega code scenarios. So that's it for that.